Well, on the line now is NHS A&E Dr. Andrew Mayerson. Dr. Mayerson, thank you very much indeed for joining us here on LBC News this evening. A little bit earlier on, we had Dr. Sarah Clark, who's the president of the Royal College of Physicians, speaking to us, saying that this a lot of the problems around the waiting list, the main issue or the main way to tackle them is through extra staffing and more recruitment and more training. We've just heard Professor Stephen Powis there saying that COVID is playing a significant part. What do you make of both of those arguments that have been put forward?
Thank you for having me. I think that the whole story is just not being told. Our waiting lists were approaching 5 million before COVID, okay? They were in a very bad state before COVID. We had an NHS funding crisis before COVID. The NHS was underfunded for a decade before COVID. The NHS had a staffing crisis before COVID. We had a beds crisis before COVID. We had a government that has just refused to listen to the alarm bells that are ringing from all corners of the NHS for the last decade before COVID, and then COVID made it a hell of a lot worse. And so, yeah, we are going into another winter crisis that is going to be quite difficult, made worse by COVID and the flu. And patients can do everybody should get vaccinated for both. That would certainly help. But the major obstacle that we have in the NHS that is really harming patients and harming staff is the government's refusal to listen. That's why you see staff from every aspect, every corner of the NHS considering strike action right now. They're doing indicative ballots. They're doing proper full strike ballots, because no matter what we do, no matter how many alarm bells we ring, no matter how many times that we say we desperately need staff, we need money, we need beds, we need social care, it doesn't matter. And it doesn't matter if the Royal College of Emergency Medicine issues strongly worded messages over and over again every single winter saying that the situation in A&E is getting worse and worse and worse and worse. The government just refuses to listen. And that's why we're so just furious about for our patients and for ourselves.
There's no question doctors and medical staff across the NHS are under acute pressure at the moment, given the pressures of that COVID has brought about, but also as well, as you've mentioned, this has been a legacy issue, not just something that has merely cropped up in the last couple of years. The government would say that they are putting more money in, they are trying to address the issue head on. There has been obviously a change in Secretary of State for Health. What's your take on what you've heard from the new Health Secretary about addressing some of these issues? I mean, granted, she's only been in post about 6 weeks, but she has toured the media studios a few times now, had an opportunity to present her case about how she's going to fix the problems within the NHS. What do you make of what you've heard?
I have very, very little faith in what the Health Secretary, Secretary Coffey, has proposed, especially because there doesn't seem to be, and I think journalists need to be asking follow-up questions every time a government minister comes on claiming that they're bringing this much money into the NHS, they're doing this plan and this plan and this plan. The government should be, after 12 years of running the NHS into the ground, the government should be issuing updates every single week on what they are doing to improve the funding crisis, to improve the beds crisis, to improve the staff crisis, and to improve the social care crisis. This comes across after, we have health secretary after health secretary after health secretary making these big, bold claims, this ABCD thing that Teresa Coffey has proposed. It's frankly, to a lot of us, it's just words. There's not much behind it. And, I was, just reading that the A&E numbers now are the worst in NHS history today. And you have to take my word for this. There was a King's Fund analyst who said that if the current workforce and spending plans are the most the government is willing to offer, then there is little chance that Health and Care Secretary's plan for patients will be delivered. And sadly, it will be the public and the patients who will suffer for those broken promises. They're not delivering. This is just something that every single person in this country should be alarmed and worried about, that this government is just not listening to anybody on the front line, any experts whatsoever saying we need to fix the NHS. We need to do it in these 4 ways. We need to bring everybody together in order to come up with some really good solutions to this. It's possible, but they refuse to talk to us. They refuse to listen. And that is why we are seeing, after screaming about this over and over and over again, trying to do it the polite way, every single winter, multiple times a year, saying the situation is getting worse and worse and worse. That is why there is such an appetite for strike action in the health service, because I didn't go into this for money. You can hear my American accent. If I wanted to go into medicine for money, I would go back to the States and earn 4 times what I'm earning in A&E right now. I made £14 an hour last year. We have nurses that are visiting food banks. This is, if you want a proper health service, you have to pay doctors and nurses well enough, because otherwise we are hemorrhaging. We're hemorrhaging doctors and nurses. We're leaving the NHS in droves. And the healthcare and the health of this nation is suffering dramatically because of this.
The government and NHS England have set an ambition of trying to eliminate all waits for patients more than a year by March 2025. Given what you've... Well, this is what I was going to ask you. I mean, do you think that's achievable?
No. I'll give you a straight answer. No, I don't think that's achievable given what they're putting into the system. If they want a world-class health system, 10 years ago, a lot of people don't know this, 10 years ago, the NHS was ranked the number 1 healthcare system in the entire world. It was the most efficient healthcare service in the world. It was the fairest healthcare system in the world. And over the last 10 years, they have run the NHS into the ground so dramatically. And, we've seen budget cuts every single year. They've tried to have efficiency savings every single year. The same rhetoric from health secretaries over and over and over again. And there was just a report today that said that if there's not $10 billion that's invested into the NHS right now, then we're going to see the physical collapse of NHS hospitals. And when that happens and patients are and staff are injured, then that is on the government. That blood is on their hands. And so we don't know what else to do. Besides, we can write about it, we can speak about it. We are arriving at strike action because this government just refuses to listen.
Just very briefly, Doctor, if you would please. I mean, just in the immediate terms, what needs to change? What needs to happen now?
Well, we need an infusion of a massive amount of money into the system. We're talking about close to £20 billion that needs to be given to the NHS, and then we need to sit down and come together. I'm in the SOS NHS coalition. It's sosnhs.org. We're having a big NHS conference on the 12th of November here in London, and we're trying to put together a plan from people from across the NHS to solve this problem, because the government is not listening, and they need to start listening to us. They need to start listening to the nurses, listening to the doctors, and listening to patient groups. They are just ignoring really everybody in this entire country and trying to pretend as if they have all of the answers to this massive problem when they absolutely don't. They need to bring everybody together to solve this problem and take this seriously. You can understand why I'm frustrated, because I hate seeing such a beautiful, perfect system. This is the best way to deliver healthcare and the cheapest way to deliver healthcare. But we have a government that just does not care about it. And it's heartbreaking taking care of patients that are suffering because of this.
Dr. Andrew Mayerson, we can certainly hear the passion in your voice. We're very, very grateful for your time. That's Dr. Andrew Mayerson, A&E doctor within the NHS and based in London. This is LBC News. We're live across the UK on DAB digital radio, on your smart speaker, and on Global Player.
LBC News.